Good afternoon, dear ladies and gentlemen. My name is Csanád Geréd, and I'm pleased to be here. I work at the hospital of Flór Ferenc in Kistarcsa. Okay, first I would like to talk about the last few years that we noticed an increase in invasive streptococcal infections, and we were curious it's accidental or does anybody else see the same? So we searched on the internet and we saw it's quite increasing, like we heard from Méhész István. So I brought just one case, or just one picture from 2022 from England. They observed in children that the cases are increasing, and not just the cases, but also the deaths and the fatality rate. So that's why we must be aware, and we should learn about each case so that we could improve medical attendance in these high mortality rate illnesses. Today, I brought with my colleagues an interesting case from our ICU. That's a necrotizing fasciitis. It's about a 30-year-old female patient with negative anamnestic data who went hiking, and she had a skin erosion on her left feet. A few days later, her leg got swollen and was painful. He was admitted to our hospital's emergency department, where they have seen the laboratory tests. There was an elevated white blood cell count with neutrophil count elevation. You can also see a C-reactive protein in the procalcitonin count, which is quite high. This was the first picture of her leg we took on our ICU. He was admitted to the angiology, where the internist was very concerned about the case and asked for a computer tomography of the lower extremities. You can see there is also air and also some fluid between the soft tissues and the muscles. The patient was given the first dose of antibiotics, ceftriaxone and clindamycin. There was a first surgical consultation, and they made the first microbiological sampling from a blister on the leg. Due to the deteriorated aspect of the patient, the internist called for an ICU consultation. That's why we admitted on our ward. And just a few hours later, we admitted here. We were fighting with septic shock and rhabdomyolysis. You can see the elevated white blood count going much more up, and the CRP is shooting out. You can see also creatine kinase level very high, and we couldn't measure the myoglobin. So we decided to do the first surgical debridement. In time, the Microbiological Institute called us and told us it's Streptococcus pyogenes. So we changed the antibiotics for penicillin and clindamycin, and in addition with imipenem. During the operation, the patient needed vasopressors, so that the anesthetist decided to prolongate the ventilation. After the operation, we have seen an increasing vasopressor need, so that we started invasive hemodynamic monitoring, and due to the rhabdomyolysis, we started the renal replacement therapy in addition with hemadsorption. I brought you a few images of the hemadsorber column and its effectiveness. regarding to a few molecules we were monitoring during the therapy. You can see in almost 12 hours, the column got fully saturated and didn't even anymore remove the target molecules. This is the second capsule. You can see the same. In almost 12 hours, it got fully saturated. But also in a few hours later, we have seen this picture. We saw further progression despite the therapy, and this was the point where the infection spread the iliac crest, so that major amputation was no more considerable for infection control. Soon, we had hard hours, hard days, but the shock started to relieve. And this patient spent 44 days on our ICU, in which 6 days with continuous venous hemodiafiltration. We used 2 hem adsorbers. We gave her IgM-enriched immunoglobulins. We made a percutant dilatational tracheostomy. We deviated her stool by a device named FlexiSeal to prevent further wound infection. In our hospital, there have been 15 interventions, surgical interventions, and we also used negative pressure wound therapy to treat this patient. The daily physiotherapies were quite hard. The patient had severe pain despite the major analgesics. We gave her remifentanil, but it wasn't enough. Just a few days before Christmas, fortunately, the plastic surgeons admitted the patient to their ward and made skin grafting in 3 sessions. You can see in the first picture that this is the base state at our ICU. There is no soft tissue and the muscles are elaborate. So it was very hard to make the plastic surgery. But we extend thanks for them they did it. And the last picture you can see when she was on a short visit on our ICU, it's quite good. At the end of the presentation, I would like to extend thanks for everyone who was involved in the case. And I would like to extend thanks for the family and the patient also, because they had faith in us and they were very patient with us. In these type of fulminant illnesses, it is vital to make a fast diagnosis, immediately give antibiotics, and if we need it, make surgical debridement. Thank you very much.